Assalamu alaikum everyone. My name is Muhammad Ali Haider and today I will be delivering lecture on pharmacology. That will be lecture number 8. Agonists that inhibit their binding molecules. Some drug mimic agonist drugs by inhibiting the molecules responsible for terminating the action of endogenous agonists. For example, acetylcholinesterase inhibitors by slowing the destruction of endogenous acetylcholine, causing cholinomimetic effect that closely resembles the action of cholinesterase agonist molecule. Even though cholinesterase inhibitors do not bind or only incidentally bind to cholinesterase because they amplify the effects of physiologically released agonist ligands, their effects are sometimes more selective and less toxic than those of exogenous agonists. And this figure describes as a useful model for drug-receptor interaction. As indicated, the receptor is postulated to exist in the inactive, non-functional form and in the activated form. The thermodynamic consideration indicates that even in the absence of any agonist, some of the receptors pool must exist in the RA form some of the time and may produce the same physiological effect as agonist-induced activity. This effect occurring in the absence of agonist is termed constitutive activity. Agonists are those drugs that have much higher affinity for the R configuration and stabilize it, so that larger percentage of the total pool resides in the RA-D fraction and a large effect is produced. The declination of the constitutive activity may depend on the receptor density, the concentration of a coupling molecule if a coupled system, and the number of effectors in the system. Many agonist drugs, when administered at a concentration sufficient to saturate the receptor pool, can activate the receptor effector systems to the maximum extent of which the system is capable. That is, they cause a shift of almost all of the receptors pool to RAD pool. Such drugs are termed full agonist. Other drugs called partial agonist bind to the same receptors and activate them. What will happen if a drug has much stronger affinity for the Ra than for the Ra state, stabilize a large fraction of the RAD pool. In this scenario, the drug would reduce any constitutive activity, thus resulting in effects that are opposite of the effects produced by conventional agonists at their receptor. Such drugs have been termed inverse agonist. One of the best documented examples of such system is the Y-aminobutyric acid GABA-A receptor effector, a colloid channel in the nervous system. This receptor is activated by the endogenous transmitter GABA and cause inhibition of photosynthetic cells. For a drug given orally to produce an effect in the central nervous system, these barriers include the tissues that make up the wall of the intestine, the wall of the capillaries that perfuse the gut and blood-brain barrier, the walls of the capillaries that perfuse the brain. Finally, after bringing about its effects, a drug should be eliminated at a reasonable rate by metabolic inactivation, by excretion from the body, or by combination of these processes. Thank you very much. Inshallah, I will be meeting you next time. Take care. Allah Hafiz.